Good morning. A couple of months ago, I decided to spend this week in Atlanta. It made sense. I had a SSCI Council meeting on Monday. I had a collaborator to meet on Wednesday. My daughter and her husband are in Atlanta, and we thought this would be a good time to spend time as a family together. Only for a few days later for Jen Cook to remind me that awards day was on this Thursday and we could not change it. So I immediately started making arrangements. And while trying to figure out how to do this, my wife asked me, why go through that trouble? I'm sure your faculty and trainees will understand if you miss one awards day. That's not what you tell me. I wouldn't hear it. But it made me think about something she said. Why would you want to sacrifice your vacation? And I thought about this term, sacrifice. We often see people walk up here finishing their fellowships, finishing their training. They receive Best Teacher Award, Best Resident Award, outstanding this, outstanding that. And we're here because we want to celebrate with them their achievement. But we rarely think about the sacrifice they have gone through to get there. Sacrifices that many of us have gone through all of our careers. And so today I want you to think about, when you see people standing on this stage, what have they gone through to make it here today? How many soccer games were played without mom or dad because they were on call? How many dinners were done without the spouse being there because somebody needed to be taken care of before they left for that day? How many experiments need to be finished on Sunday evening while everybody is at home watching, I don't know, The Walking Dead? Okay? On this day, we remember Werner Arbert, who was born back in 1929 and this week, a Swedish microbiologist who won the Nobel Prize in 1978 for the discovery of restriction enzymes that are important for the work we do with DNA. Torsten Niels Wilson was also born on this week, Swedish neurobiologist who won the Nobel Prize in 1981 for his work on brain function. Remember George von Békésy, probably killing that name, a Hungarian-American physicist or physician who in 1961 won the Nobel Prize for understanding how the cochlea works. How do we transfer sound through nerves into our brain? Remember Aristides Agramante and Simone. I've been practicing this week because of his work with the Yellow Fever Commission in Cuba in the late 1800s. But we rarely think about the sacrifices that these people made to achieve what they made. We celebrate their achievement, but we don't think what they went through. So today, as we go through this celebration, I want you to think about what have they gone through to make it, and how do we contribute to that achievement? That's important. So I made my arrangements, and I didn't count on two things when coming here today. One is I developed significant bronchitis, so I'm only here because I've been on pills and prednisone. Had to call somebody in Atlanta to make some arrangements for me. But also, I forgot that I was on the list. You know what list I'm talking about? It's that list that every airline has, that if you're on it, you're guaranteed to be late, delayed, canceled, switched. In my case, I always miss my second connection. I get transferred to Cincinnati, and I'm driving overnight to Louisville. I'm getting used to it. This is probably the third time it happens to me in the past 6 months. Sometime in the middle of the night, past midnight, I get a phone call from my wife trying to figure out if I'm alive and where am I. She won't ask me if this is worth it. But she asked me, what do you get out of this? Have you asked yourself, what do you get out of this? I know it's nice to celebrate everybody's achievement, but have you had the chance to look around at the people around you every time there's a name mentioned today? Have you looked at the faces of the program directors, of the mentors, of your chair? We're smiling because we are proud and we are inspired. And so my answer to my wife last night was, what I get is inspiration. And I sacrifice my vacation to be inspired. And that is more than worth it. That is more than worth it. And so it's important to be here. And because it is so important to be here, we even give an award for the highest attendance at Grand Rounds to a faculty member and to a resident. And again, I think this year, the faculty member, you probably say it out loud with me, is Dr. Forrest Arnold. You do it over here? Do it over here because I think we need to take pictures afterwards. And then the resident is Sarah Reed. Is Sarah Reed here? If you weren't, you lose the award because that means you missed one Grand Rounds, no? So congratulations to you both. And what we will do today is what we've done in the past couple of years is to accelerate this process because I know everybody's busy on Thursdays. I'm going to be moving to the end of the stage. Don't pay attention to us. We'll be taking photographs. We'll be posing. But while that is happening, the good thing is happening on the podium. And with that, I want to welcome you to 2015 Special Edition Grand Rounds of the Department of Medicine, and with your host, Jennifer Kuka.
Thank you very much, Jesse, and thanks for all the effort it took to get here today. As we proceed with the ceremony, several of you will be called forward to receive an award. Excuse me. And so, again, after doing so, please meet Dr. Roman and Jason right in the corner here as you're seeing them now. So we'll begin with awards given by the Internal Medicine Residency Training Program. The training exam awards are generously sponsored each year by one of our community physicians, Dr. Mary Berry. She generously established this award in 1997, so we're going on close to our 20-year mark now, to recognize the intern with the highest score on the exam, as well as the PGY2 and PGY3 residents who showed the greatest improvements in their scores from the prior year. I'm happy to announce this year's awardees. When I call your name, please come forward to receive your award. For the PGY1 with the highest score on the ITE, the award goes to Dr. Taj Rahman. For the PGY2 with the most improved ITE score, the award goes to Dr. Adam Robison. And for the PGY3 with the most improved ITE score, the award goes to Dr. Tasha Henry. In addition, we wish to honor the residents in the second and third years of residency who received the highest scores in their class on the ITE. For the PGY2 class, recognition goes to Dr. Bobby Burks. Come on down, Bobby. And for the PGY3 class, recognition goes to Dr. Udith Chadha. Wanted to let them get caught up over in the photo booth over there. We'd also like to recognize the divisions representing the areas in which the residents scored the highest on the ITE and the division for whom the score was most improved. We view this as a reflection of your outstanding efforts to teach our residents, and thank you for your dedication. The award for the division with the highest score represented on the ITE goes to Pulmonary Critical Care. Take a picture with yourself. Yeah, it goes to you. You need to do a selfie for this one. And the award for the... Yeah, take that, American Airlines. The award for the division with the most improved score on the ITE goes to Cardiology. Somebody from Cardiology has to come accept this award. They're arguing over it. All right. Okay, let's do it. Come on, Glenn. He didn't even. This will teach the rest of you to pause at your chance to come up here. We'd also like to recognize the division whose subject area garnered the highest score on the most recent ABIM exam taken by last year's graduated residents. The award for the division with the highest score on the board exam goes to Rheumatology. Any rheumatologists here?
They're busy working.
Okay. Our next awards are the Excellence in Teaching Awards. These awards go to the division, faculty member, and fellow who are chosen by the internal medicine house staff for demonstrating excellence in teaching. The residents have chosen to honor the Division of General Internal Medicine for excellence in teaching. Next, we have our faculty member chosen by the residents for excellence in teaching. This faculty member joined us only a short time ago and yet has already contributed so much to our educational endeavors, both in the hospital and behind the scenes. I'm delighted that the residents have chosen to recognize her for these efforts. Congratulations go to Dr. Laurel Brown. The fellow chosen for the award for excellence in teaching completed his residency training right here at UofL. He was an outstanding resident, and it doesn't surprise me at all that he's now being recognized for his teaching and his role as a pulmonary critical care fellow. The award goes to Dr. Patent Thompson. We'll now recognize a few of our residents for their outstanding work. The interns are asked to select the PGY2 resident who best exemplifies excellence in teaching. The winner of this year's Outstanding Teaching Resident Award is known for his dedication to the most detailed of medical knowledge and his ability to make sense of it and pass along this knowledge to others. I'm pleased to announce that the award goes to Dr. Bobby Burks. The award for the most professional resident is chosen by the house staff for the graduating resident who most consistently demonstrates professionalism. This year's winner is truly an example of what it means to show leadership through quiet role modeling, humility, and a strong sense of integrity. In this case, I feel very fortunate to say he will be continuing this professional leadership in the residency program in the role of chief medical resident. The award goes to Dr. Ryan Hogenkamp. The Outstanding Senior Resident Award is chosen by the house staff and given to the resident who best exemplifies leadership, teaching, and excellent clinical skills. This year's winner has left an indelible mark on our residency program. His absolutely incredible medical knowledge base and clinical skills have resulted not only in excellent care of patients, but also served to challenge his peers to reach a new level of clinical ability. I'm delighted to present the Outstanding Senior Resident Award to Dr. Udith Chadha. This next award is given to a resident who balances common sense, intellect, and commitment in a community setting. I'll now ask Dr. Ray Knight to come forward to present the award for resident performance in the community setting.
Yeah, quickly, sometimes this award's difficult, sometimes it's really easy. This year it's really easy, and to the department's credit, you're really getting better and better residents. Bobby Burks gets this award this year. Now, if I can just get the hospital to start cutting, there's a check that comes with this, and in spite of my efforts to give them the name earlier and earlier, they assure me it will be out tomorrow.
I'm very relieved that Bobby showed up this morning, since we can't tell people in advance. Last year, a new award was created by one of our departing chief residents for quality improvement, Dr. Anna Burke. The award for quality and safety goes to a resident chosen by the program directors who shows a commitment to the physician's role in quality improvement and patient safety. This year's award goes to Dr. Wasik Rawasia. It's now time to recognize our residents who will be leaving us this year. And first, I'd like to recognize our preliminary interns who work tirelessly to give our patients excellent care and learn as much as they can before moving on to their categorical programs. This year's group has been reliable, consistent, hardworking, and fun. We'd like to sincerely thank you for your contribution to our program and to the care of your patients. If any of you are here today, because we usually work them so hard that they can't always come, please stand up in place when your name is called, and we'll hold our applause until the end. Our prelim interns are Shakib Ahmad, Radiology, UofL, Brent Bolig, PM&R, UofL, Ashley Dickinson, Dermatology, Medical College of Georgia, Josh Gross, Research at Indiana University, Jeremy Hazley, Anesthesia, UofL, Seth Haywood, PM&R, Virginia Commonwealth, Adriana Henson, Radiation Oncology, Wake Forest, Audra Isaac, Dermatology, East Carolina University, Tala Qasim, Ophthalmology, UofL, Jeffrey Kenner, Radiology, University of Kentucky, Jennifer Moody, PM&R, UofL, Brett Mueller, Ophthalmology, UofL, Mark Mugavin, Ophthalmology, UofL, Chandra Shah, Radiology, UofL, and Will Wilson, Radiology, UofL. Let's give Jeremy a huge round of applause. Did I miss that? Oh, and Brent, you came. That was really a round of applause for everyone, of course. It's almost time now to recognize our graduating third-year internal medicine residents. This is always a bittersweet moment for us as program directors. Before I begin announcing the graduates, I need to get the rest of my team up here on stage. From the bottom of my heart, I would like to thank Doctors Barb Casper, Nancy Kubiak, and Clay Smith for being incredible colleagues and friends whose tireless efforts are the backbone of the residency program. Please join me in a round of applause and thanks for the associate program directors. Graduates, please come forward as your name is called, and we'll hold applause until the end. We'll take a class picture once everybody is on stage, and please listen closely. We'll also meet in the courtyard outside the cafeteria to take another class picture immediately following this ceremony. Geetika Bhatt, Hemonc Fellowship, Ohio State University. Udit Shada, Palm Critical Care Fellowship, University of Southern California. Susie D., Faculty, Internal Medicine at UofL. Tasha Henry, GI Fellowship, UofL. Ryan Hogenkamp, Chief Medical Resident, UofL. Anub John, Cardiology Fellowship, UofL. Jonathan Kapp, Primary Care, Norton Healthcare, Louisville. Justin Kingery, Global Health Research Fellow, Cornell University. Felicia Longnecker, Primary Care, Baptist Medical Associates, Louisville. John Mears, Nephrology Fellowship, Johns Hopkins. Vivek Master, Cardiology Fellowship, Virginia Commonwealth. Matt Midaw, Hospitalist, Houston, Texas. Kavita Patel, Hospitalist, UCLA Santa Monica Hospital. Wasik Rawasia, Cardiology Fellowship, UofL. Emric Ray, Palm Critical Care Fellowship, Yale University. Eric Schneibel, Cardiology Fellowship, University of Florida. Tyler Sharp, Chief Medical Resident, UofL. Sanjeev Singh, GI Fellowship, University of Cincinnati. Rahul Sinha, Cardiology Fellowship, Allegheny College. Ali Smith, Chief Medical Resident, UofL. And Seth Weaver, Hospitalist, First Health Moore Regional Hospital, North Carolina. Congratulations. Let's give them a big round of applause. Do we need a front row? I know which row I'm in.
Kavita, you should be on the back row.
I would now like to ask our three chief residents, I hope we're all here, to come stand up here so I can embarrass you just for a moment. Alan Kerr, Melissa McCarr, and Ishan Mehta, please come join me. I'll be recognizing each of the chiefs tomorrow at our graduation, but I can't resist the opportunity to say a few words about this amazing team of people. They've frequently put the needs of the residency program above their own this academic year. They've been reliable, kind, tough, helpful, and fun to work with. As our education chief, Ishan has been in charge of the didactics program, which has undergone many positive changes this year, and he'll continue to be a superstar at UCLA, where he'll be a pulmonary critical care fellow. Melissa has made great strides in elevating the importance and effectiveness of the chief position in charge of quality improvement, and she'll make us proud next year as a nephrology fellow at Duke University. And Alan has been a leader for our residents and has shown it's possible to survive a year as scheduling chief without killing the majority of the residents, although at times I think it was a close call. Being scheduling chief is a thankless job at times. As for the program directors, we are extraordinarily thankful. Thank you all for everything. Let's give these guys a big round of applause. Take it down. Dr. Workman will now recognize the graduates of the MedPeds residency program.
Hello. This year we have 4 graduates, and I'm very proud of each of them. And I will call each of them forward and say where they're going. The first is Bo Bailey, who will be an academic MedPeds hospitalist with Intermountain Healthcare in Provo, Utah. Next is Laura Bishop. She will be an emergency medicine clinician at Kosare Children's Hospital and will also be doing hospitalist work for Sellersburg Internal Medicine and Pediatrics in Indiana. Next is Suma Chinabotla. She will be doing an adult GI fellowship in UT Houston. And last, we have Brandon Watson, who will be an adult hospitalist with St. Elizabeth Hospital, as well as doing pediatric outpatient work with Cincinnati Children's Hospital Medical Center. Thank you.
Dr. Casper will now present the awards from the Division of General Internal Medicine, Palliative Medicine, and Medical Education.
I'm very happy to be able to present the teaching awards for the Division of General Internal Medicine, Palliative Medicine, and Medical Education. In recognition of the different challenges of teaching in both the inpatient and outpatient settings, Dr. Ann Shaw instituted these awards for faculty to recognize that, and I would like to say a few brief words about this year's recipients. The winner of this year's Teacher of the Year in the ambulatory setting has been noted to be approachable, have contagious enthusiasm about teaching, and creates a great learning environment in the ambulatory setting. He is accessible and serves as a great role model. One person noted that his physical exams are a bomb, and I am guessing that that was meant as a compliment. I'm very pleased to be able to present this year's award to Dr. Mike Stillman. I'm also happy to present the award for the most outstanding teacher in the hospital setting. This year's recipient is a seasoned clinician who is noted for being a great role model, who incorporates valuable practical lessons into caring for patients while maintaining an academic environment. She is efficient and truly cares about her patients. She provides effective and timely feedback in a non-threatening way and was noted to be as a role model by many of the residents. The word awesome appeared numerous times on her evaluations, and I'm extremely pleased to present this year's award to Dr. Charlene Mitchell.
Dr. Boley will now present the awards for cardiovascular medicine, followed by presentation excuse me, of the fellows by Drs. Hirsch, Ikram, and Dean.
Okay, so every year we recognize the most outstanding research fellow in cardiology, and we are blessed with having a difficult choice. But this year we have selected again Dr. Matt Keith as the recipient of the Research Fellow of the Year. Matt, this is the second time that you receive the award. So if you do one more year of research, you may do the hat trick, right? That's what they say. But Matt has been absolutely exemplary in his performance. He has done groundbreaking work discovering a new stem cell in the heart, which is resulting in a patent and several manuscripts, and it really opens up a new exciting area of research, and has done all of that mostly on his own effort and initiative and creativity. So thank you, Matt, for your contributions. We also have an award for the Outstanding Research Faculty of the Year. So in cardiology, it's a strange division. About half of the faculty are PhDs and half are MDs. And this year we have selected Dr. Brad Hill as the recipient of this award. Brad has joined us recently and has already done outstanding work in regenerative cardiology, characterizing the metabolism of cardiac stem cells, and has played a crucial role in the program project grant that we have. So thank you, Brad, for your contribution. And finally, we have the Outstanding Clinical Faculty Award of the Year, which is easily bestowed to Dr. Glenn Hirsch. Where is Dr. Hirsch? Is he here? I don't need to say anything about Glenn. Everybody knows it. But the thing I like the most is that you can email him anytime, day, night, weekends, Sunday, Christmas, whatever. In 5 minutes, you get a response. So I'm taking a shower, but I'll email you later on, right? Sometimes. Right. Thank you, Glenn.
So we're calling Dr. Hirsch back to the mic now so he can do his part.
Don't touch my stuff. Thank you. So I just wanted to recognize our graduating fellows. We had the graduation last night, which was fantastic. It was the first year that we gave them engraved bats. Dr. Bully suggested adding an award next year for Gladiator of the Year after you guys battle it out. So if I know at least one fellow is here, if the others are here, please stand up. But our graduating fellows are Bassem Abazid, who's going into private practice in Tennessee, John Bergset, who'll be moving back out west into a hospital in Boise, Idaho. Brandon Elmore, he has 3 more weeks, but we think he's going to make it. He's going to do interventional at Case Western. Shahab Gafgazi will be staying on as faculty here. Amr Mohsen's doing interventional cardiology at Beaumont in Michigan. Ajay Pachika will be doing interventional at the University of Oklahoma. Andre Saad is here, and he's going to be going to Kansas next year. We're going to miss him. Robert Sawyer and Joseph Eliam are both doing interventional cardiology here. And I'll stop there so that Sohail can talk about who the graduating interventional fellows are. Thank you, Andre. Oh, Andre, you're representing the fellows.
Come on forward for a picture.
Good morning. It's really a privilege for me to present the graduating interventional cardiology fellows. You know, it's always a mixed emotions because you get so much of interventional fellowship. They spend so much time with you. It's unbelievable. And this year, I'll ask both our fellows to come forward, Dr. Amir Rahman and Dr. Praful Rahija. They were both our general cardiology fellows, and now they're completing the interventional fellowship. And I was mentioning in our graduation last night that this group is a unique group that for the first time now, they are being certified in 3 separate specialties of interventional cardiology, naming coronary intervention, endovascular intervention, and structural heart disease. They'll be certified in all. Both of them have more than 1,000 procedures each. And again, this is a record for our division that in the last at least 10 years, I have not seen anyone that much. Before I give them a certificate, there are 3 categories of fellows. One is that you never hear from them ever again. The second is you hear from only if they need something. And the third is the fellows who will continue to call you irrespective of, whenever they're in town. And I'm sure these 2 guys will be in the last group. So Dr. Amir Rahman would be going to Santa Fe, New Mexico for requirement of his visa. And Dr. Praful Rahija will be going to Bangor, Maine. So please, congratulations.
And I'd like to recognize our graduating EP Fellow of the Year. He completed his cardiology fellowship training here at UofL and has done 2 years of EP training here. And he is the most outstanding EP Fellow that we've had this year. Dr. Martin Espinosa is going to be going into practice at St. Thomas Hospital in Nashville.
Dr. Winters will now present the endocrinology fellow.
Thank you, Jennifer. Dr. Arshpreet Kaur will be completing the fellowship in endocrinology, metabolism, and diabetes, and she was the unanimous selection for graduating fellow award from our division. But she's a wonderful fellow. She's very, very capable and caring, and she's really a role model for all the doctors and perhaps some of the attending physicians. And she's going on to the University of Miami to join her husband, and she will be a fellow in geriatrics, and she's interested in laboratory research and patient research, and I think she's destined for a career in academic medicine, and I hope we've helped her lay the groundwork for her future career. Congratulations, Arshpreet.
Dr. Para-Julie will now present the GI Award and graduating fellows.
So we have 4 fellows graduating this year. All of them have done extremely well. Everybody served as co-fellow, co-chief fellow in various roles, scheduling, conferences, academics. So I'd like to call them if they're here. Dr. Alan Lamb is going to go to Henderson, Kentucky. Alan is not here. Brian Barley is a Louisville native. He's going to stay in private practice in Louisville, and he also is not here. Edmundo Rodriguez is going to St. Louis in private practice. Come on up, Edmundo. And Endesha Omer is considered this year as not as productive because his in-service score went from 99.8 percentile to 99.6. But regardless, we're really happy that he's going to stay with us in faculty. And I would also like to announce the Teacher of the Year, GI Teacher of the Year. And this year, as in many years in the past, it goes to Luis Marzano. So I think in the future we should just give you a lifetime perpetual award and give the other faculty a chance. Thanks for all that you do.
We were talking about renaming the Austin Block Award to the Forrest Arnold Award, too, for that same purpose. Dr. Ramirez will now present the Infectious Diseases Fellows. Dr. Arnold will now present the Infectious Diseases Fellows.
I can impersonate his voice, but I'll spare you. This week, it's 2015, and an orthopedic surgeon asked, why can't we give all my patients the same antibiotic? And you're laughing, but I had to answer that with a straight voice, straight face. The field of infectious diseases, of course, is very important, and I'm privileged to be able to have 3 graduates here that we're going to move on, and this is the most prestigious and important fellowship at UofL. So that's also a privilege. The first is Johnson Brito, who's going to stay in Kentucky up near Covington and go into private practice. The second is Francisco Fernandez, who's going to stay with us and work in the bone and joint ID service. So Jesse, you'll have another ally in infectious diseases. And finally, Rami Husseini is going to go down to Florida and be a hospitalist. Thank you very much, guys.
Dr. Clucker will now present the Medical Oncology and Hematology Fellows.
Good morning. I'm very happy to announce the graduation of 3 fellows. I think 2 of them are here. Maybe they want to come up here, Monica and Jaspreet. This has been a very good year for the program director of Hematology Oncology. Very bright fellows. It's been a pleasure to work with. Very much scholarly and academically involved. Monica, as you know, she trained here in internal medicine, was our chief fellow. She was involved in the mobile mammogram and research on breast cancer. Jaspreet has been very busy from his first year in the laboratory in drug development, and he will continue in drug development and does his PhD here. Joy, who cannot make it here because he had car trouble, he will go to the bone marrow transplant program in Mayo Clinic, which is very, very competitive, and he earned it. He worked also very hard in the laboratory with AML. So Monica will stay with us as junior faculty, continuing with breast cancer, so I'm very glad to keep her here. Jaspreet will stay with us as a postdoc graduate working on his drug development, and he hopes to get his degree done in the next 5 years. And as I said, Joy will go to Mayo Clinic. Good.
Dr. Nyack will now present the Nephrology Fellows.
Thank you, Jen. It is my pleasure to announce our graduating fellows for the Division of Nephrology. We have 3 renal fellows graduating this year, and you guys can step down. Dr. Hind El Said, Dr. Srinivas Iskapali, and Dr. Harmeet Groom. Dr. El Said came to us from Greensboro, North Carolina, where she worked as a hospitalist, and she goes home to SUNY Upstate, where she joins a hospital-based nephrology group. Dr. Srinivas Iskapali is a hospitalist as well, who came to us as a renal fellow from Detroit Medical Center, and he goes to Shreveport, Louisiana, where he joins a private practice. And last but not the least, Dr. Harmeet Groom, who was also a chief fellow and did an incredible job as a chief, especially with the schedules, keeping everything fair and professional. He goes to Fresno, California, where he joins a private group. And I'm really happy that all 3 found good jobs in the cities they wanted to move to. So congratulations to you all and good luck.
Dr. Saad will now present the Pulm Critical Care and Sleep Medicine Fellows.
Good morning. We do have 3 graduating fellows this month from Pulmonary Critical Care, and 1 fellow will be graduating in December, which we're going to also acknowledge today. So our 3 fellows graduating this month, first one is Imran Abu Athura. I'm not sure if he's here. Probably not. Second one is Ihab Haj Ali, and the third is, Ihab is here. Can you come down? And third is Muhammad Yassin. These are 3 fellows who are graduating in June, and 2 of them actually are staying in town. Ihab is joined a group in Baptist East End, and Muhammad is going to be joining KPA group at Jewish Hospital. Dr. Imran is going to be moving to Houston, Texas. The 3 fellows have really done an outstanding job in these past 3 years. We just came last month from the ATS, and 2 of them had at least 3 posters and abstracts, and they did a very good job there. So congratulations. Then the fellow graduating in December is Dr. Patent Thompson, who just recently awarded the teaching resident or teaching fellow. Patent will be graduating in December. He joined us, of course, off cycle. He did an outstanding job, received 2 awards during his fellowship as a teaching of the year or fellow teaching of the year, and also fellow research of the year. I don't think he's here, but he will be joining a group at Lexington, Kentucky, which we're happy for him because he's moving for family reason. We tried to keep him with us, but I'm sure that he probably will come back to us in the next few years. Then lastly, the sleep fellow, Dr. Karim Olkirsch, who did his pulmonary critical care here and is finishing his sleep fellowship this month. Karim, we call him publishing machine. Just to tell you, in 2014 he had 6 posters, 14 abstracts, and 12 publications. And I'm not exaggerating. This is his CV. He started 2 research projects during his sleep fellowship. One already completed, and he submitted an abstract to CHEST, and the second is almost done. Kareem, fortunately, would be joining us as a faculty starting next month. He's on vacation right now, so he's not here. Congratulations.
Is there anyone who'd like to present an award who I've skipped or forgotten? Don't move yet. I'd like to thank you very much for attending this year's Awards Day. Would you please give a round of applause at this point for Julia Klinkenbeard and Rita Matinich, who make all things possible. I'm honored to serve as program director and work with such fine faculty and trainees. I'd like to ask you to please stay in your seats because we're going to take your picture. And actually, if everyone would please just stand up and move to the middle so we can fill the middle rows and Jason can get our picture. Then you are free to go, except for the class of 2015 who needs to meet me in the courtyard for a picture. Not okay. No, you're not. Free to go.
Just one final word. I hope you realize how Awards Day also highlight the progress of the department. We heard that one of the new divisions, literally new divisions, had made an impact on how our residents score in their tests, rheumatology. We heard that one of our faculty who just joined us about a year ago, perhaps a few months ago, Laura Brown, got the Best Teacher Award. We have been pushing the department into more quality and safety. There's now an award for quality and safety. We heard that our candidates go to Yale, Hopkins, some of them stay at UofL, USC, Cornell, and several others. We heard that there's a universal orthopedics antibiotic. We heard that there's the discovery of a new sensor in the heart. Awards Day highlights the best in each and every one of us. I am inspired. If you are too, take the time to inspire somebody else today. Thank you.
Okay, if we could move, who are you people leaving? No. Come sit in the middle of the auditorium and it'll take 90 seconds and we're going to get a group picture.